All right, so in this video, we want to discuss briefly the inguinal canal. We have been explaining the inguinal ligament, the iliopubic tract, and I am sure you understand the orientation of the external oblique, internal oblique, the transversalis fascia and the transversus abdominis muscle, how they are oriented. We also hope that you understand the attachment of the inguinal ligament, what forms the inguinal ligament. The inguinal ligament, just a recap of what we talked in the previous video. The inguinal ligament is attached laterally to the anterior superior iliac spine and medially to the pubic tubercle. It has other ligament that reinforce it on the medial aspect because that is where the reinforcement is needed. We have the pectineal ligament of Cooper as well as the ligament of Gimbanet. All of them are reinforcing the medial aspect of the inguinal ligament. Now, the inguinal canal is an obliquely directed passage. It's about 4 centimeters long. It runs inferior medially through the inferior aspect of the anterior abdominal wall. So let us take back again that definition of the inguinal canal. The inguinal canal is a passageway, it's an obliquely directed passageway that is 4 centimeters long, approximately 4 centimeters long. It runs inferior medially through the inferior aspect of the anterior aspect of the abdominal wall. Now, this definition is standard. Structures that pass through the inguinal canal, the main occupant of the inguinal canal is the spermatic cord in male and the round ligament in female. The round ligament in female, the female round ligament is a ligament that is directing the ovary, but because the ovary did not traverse the canal, so the round ligament attaches to the subcutaneous layer of the labia majora in female. And the canal still persists in female, and the canal is called the canal of Nuck, N-U-C-K. In male, the inguinal canal is very, very important because the testicle traverses through that canal. It passes through the canal and it passes through 2 openings, the deep inguinal ring and the superficial inguinal ring. So, and then exit through the superficial inguinal ring and enters into the scrotum. The main occupant, once again, is the spermatic cord. We're going to talk about the spermatic cord in a short while and the anatomy of the spermatic cord. And it is important to know other structures that pass through the inguinal canal. Apart from the spermatic cord, the other structure that passes through it is the ilioinguinal nerve. The ilioinguinal nerve. The ilioinguinal nerve, as well as lymphatic vessels, and rarely you can have blood vessel, very rarely. So the canal has 2 openings, a deep inguinal ring and a superficial inguinal ring. So the deep inguinal ring is related very closely. If you look at it, it is related closely to the transversalis fascia. It is related very closely to the transversalis fascia. And the superficial inguinal ring is related closely to the external oblique muscle, the external oblique aponeurosis, right? Now, this should help us understand when we begin to talk about the differences between direct inguinal hernia and indirect inguinal hernia. The next video is going to discuss that.